You know, when it comes to medical supplies, things like that, we always wonder about how does insurance help us out when it comes to needing something like that? Well, what we do is we come talk to the expert,
Hey.
David Wolf with the Grace Healthcare. How are you?
Great. How are you, sir?
I'm doing great. You know,
Good.
people, health insurance changes seems like all the time.
It does. It does, and never more than now. It seems like we're getting a new directive of some sort from either Medicare, Medicaid, or Blue Cross Blue Shield, or any of the other private insurance organizations, and they're saying we need this documentation, or we need this, or the reimbursement is lowered. And what I really want to talk about is how this affects the way insurance companies and Medicare is now looking at us as patients when we come into a hospital or we need service. They're trying to package it as one global continuum of care.
Mm-hmm.
So if you go in for a total knee surgery, they want to see that the hospital's responsible for that, the doctor's responsible for that, the medical equipment company is responsible for that, the home health company is responsible for that. And if things don't work out in those 90 days, or in the case of the hospital, 30 days, if that patient has to come back, they have to redo it, or they have to completely pay for that service all over again.
So you have to pay another deductible?
No. It's charged back to the hospital. So,
wow.
So what's happening is that when the patient's leaving the hospital, they want to make sure this patient is taken care of. You know, they want a great home health company. They want a great medical equipment company, and they want great equipment. And we're all doing this together. We'll work with the hospital, we'll work with home health, the medical equipment company, we'll work with, all three of us will put this together for fewer dollars. There's less money, the reimbursement's less, but they're trying to package it. And so that patient is taken care of by all three, and all three, it's like three sets of ears, looking and three sets of eyes, looking and taking care of these patients. So they do not, the hospital is it's at a premium now that they can't have patients coming back. And what's happened with Obamacare is there are more people with health insurance. To a great degree, though, there are a lot of patients that are going without health insurance, is paying the penalty. I mean, it's hit a lot of people. It's just they can't afford
because I was going to say the health insurance is higher than what the penalty is.
That's right, right. You know, $900 a year penalty, but your insurance is $600 a year, or whatever it is. So they eat the penalty. Well, these people turn into going into the emergency room, and they become they'll be either become responsible for it, or the hospital eats that payment.
Right.
Well, if this person doesn't have insurance, comes back to the hospital within 30 days, the hospital has to pay for it again. So there's a lot of incentive to get patients in, get them taken care of, and get them out as quickly as possible, which saves money. But they have to provide better service, and that's the good side of it. It's just the demand. We're running out of doctors, and we have fewer people that can see people that can see these patients that need to go to specialists.
Fewer doctors actually working with the hospitals.
Yeah, absolutely.
They're kind of just out on their own.
Well, and we're getting more because of there are more people with health insurance that may have not had it before because they're forced to have it now, or and they're coming. Just like a lot of these hospitals, they're full. I mean, it's just bonkers. I mean, they're
changing ownership.
Yeah, and what's happening? They're not surviving, and we're running on the coast here. We have some hospitals that are having a tough time, but it's turning around and pushing patients to other hospitals that are just coming unglued. I mean, they have so many patients. So it's a very interesting time. Grace Healthcare's our charter, or our plan, our goal always is to continue servicing patients the best we can. And the trick is we're not getting paid as much, but we're still doing our very best to provide the same services that we've provided in the past. In fact, the demands dictate that.
Right.
Well, how do we solve that? How do we continue providing that great service with fewer dollars? Well, you have to improve up your volume of patients, and that sounds crazy. You know, you'd really like to have just a handful and do the best you can. Well, now we have to, you know, with the margin smaller, you have to increase in volume.
Yeah, but you got a great staff of people working for you, David. I mean, so many different ends of it. Whether,
Oh, gosh,
you know,
yeah.
in the individual stores, the ones that, you know, when it comes to dealing with the insurance company, that the patient can, you know, call and find out, you know, what am I covered in? You know, what's covered with me? Or, you know, what do I need to do?
When you say that, there's something that's really changed, and I wish it wasn't like this, but this is something that's really changed, is that because of the insurance requirements, because of the changes in reimbursement, we are spending more time with patients when they come in. The way we used to do things, if somebody would walk through the door, hey, you need a wheelchair? We'd sling it out the door, and they'd go out the door with it. We'd handle the paperwork. Doctor would send us a script, and everything was great. Now you have to have written orders prior to delivery. So if a patient comes into our office, or a patient leaves the hospital, we have to have a written order prior to delivery, and it has to be clearly stated what kind of chair or what kind of bed, and it's become so much more demanding paperwork-wise, it slows our process down. And we're doing our very best to, you know, and we're spending a lot of time. I feel like we've become medical equipment educators. Mm-hmm. And in fact, that's why I think we're doing this now. I really want you to understand, want people to understand what we're going through and what we're trying to provide. But it's a situation that's just our clinicians and our clinicians and our medical equipment specialists, our power chair and wheelchair specialists, our pharmacy techs, everybody that's involved is spending more time with documentation than taking care of patients.
Wow.
It's a you know, and I get it, you know, that there probably was some misuse and some abuse, and we're really paying the price now.
Yeah.
So.
Well, it's great that y'all keep up with all the information, that you let the viewers keep up with all of that. Of course, you know, Grace Healthcare, you got how many locations around the coast now?
We have 11 locations now.
Wow.
And we're about to open in Birmingham, Alabama. Yeah.
Well, you can come to the one here that we're at today, here on Pops Ferry Road, or in Broad Avenue here in Gulfport, the main office. But anytime that you need some help, give them a call at Grace Healthcare.